Hey, this is Dr. P here. This is a very interesting case. This is a patient who came to see us about 3 months ago, 12 weeks ago, with pain on the outer side of their knee. Now, this is an MRI from back in the end of July, and this is an MRI from yesterday. And basically, there's two types of cartilage in the knee. There's the cartilage on the end of the bone, which looks like the white on the end of a chicken bone. It's that smooth cartilage, kind of looks like the tread on a tire. When that wears down, that's what arthritis is. There's also the meniscus cartilage, which are the little shock absorber cartilages in between the bones. Here's the thigh bone, here's the shin bone, and those are the shock absorber cartilages. That's like the cartilage you hear about, like when an athlete tears the cartilage in their knee and needs to have arthroscopic surgery. She came in with a tear of her lateral, her outer meniscus. So this is like looking at the front of the knee. This is on the inner side. This is on the outer side. It's just a slice through the knee. It's an MRI. And there's a little white line right here. This triangle is the meniscus here. There's the medial meniscus, the inner meniscus. No white lines there if you can zoom in. And then the lateral meniscus, there's a white line right there. But just as importantly, the bone should be black on an MRI, but you see this white area. So what happens is, as the cartilage wears down, more and more force gets transmitted to the bone underneath, and the bone can start to break down faster than the body can heal itself, and you get these little stress or microfractures. You can't see them on an x-ray, you can only see them on an MRI, and these white areas are the areas of stress or microfracturing. Traditionally, this would need surgery. She absolutely did not want to have surgery. I went over surgery with her versus no surgery, and she wanted to undergo bone marrow aspirate cells. Bone marrow has stem cells, it has other cells that help the stem cells, and then PRP, platelet-rich plasma. She wanted to try to get this better without needing surgery. So 12 weeks ago, I injected into this meniscus tear using an ultrasound, making sure I got it in the right spot, taking her bone marrow cells and her blood for the PRP, and I injected into the bone as well. I injected bone marrow from a good area in the pelvis area right here, where it's good right up into your 80s, and I injected it into the area right here. She's in her 60s, and as we get older, that bone marrow doesn't have as many good cells in it. So I took good cells, injected them where the bad area was, and here is her MRI from yesterday. The bone is completely healed. Even the meniscus, there's a little signal there, but that looks a lot better as well. She's having no mechanical symptoms. She still has some swelling. We had limited her for 8 weeks, so she's not 100% yet, but clearly the MRI shows significant improvement from the treatment.